This is Diary of a Nation. I'm your host, Christina Zlotnick. My podcast explores the human experience. Karin Chen is a nurse practitioner. Over the course of her career, she has assisted children who gave birth to children and women who gave birth to babies they had to turn around and bury. Today, her focus is women's reproductive and sexual health care. Thanks for joining me today. Why did you choose nursing as a career?
You know, my particular field of interest is women's health. And so it was looking at, the physical aspects of being a woman, and in addition to the emotional health and social aspects and sense of community and our spiritual lives, and how that all melds together to influence our health and our families and our roles in society.
You graduated from Elms College, at the time an all-women's college. How did that experience shape you?
So I chose that college because it had a nursing program. I had initially had interest in doing an English major and wanted to go to Mount Holyoke College and had gotten accepted. And then I really started to think practically about what I was going to do with this English degree. And I didn't want to be a teacher. I did want to write, and I still do have an interest in writing from a health and wellness perspective. But, I chose an all-women's college because it afforded me the opportunity to really focus on my studies. And I started to get more interest in female voices at that time as well. I was listening to my mother at that time was going back to college, and, she had started taking classes at Smith College and, different kind of interests in women's and feminine spirituality and empowerment and things of that. So
what kind of nursing did you initially practice?
I initially was a labor and delivery nurse at Bay State Medical Center in Springfield, Massachusetts, and I loved it. I did not expect to be in women's health in that aspect of just labor and delivery. I wasn't even a mother at that time, but I really liked the critical aspect of critical thinking that involved taking care of women during their pregnancies. Most pregnancies are really completely healthy. I would say 90%. Maybe at that time they were 90%. Now, the overall society is less healthy. And in addition, women are unhealthy too. I even see teenagers now that have high blood pressure and things of that nature. But I loved my career in labor and delivery. I did a lot of high-risk pregnancies at that time, and I had a high percentage of teen population, and I really enjoy working with teenagers and adolescents because it's like planting seeds of health. And I really get fired up about it and passionate about it. Although I do like all aspects of women's health, I really do enjoy adolescence. So,
as a labor and delivery nurse, could you share some stories of the teenagers and of the older mothers as well?
So I think, at the time when I worked in labor and delivery, Holyoke, Massachusetts had the highest teenage pregnancy rate in the country. I don't know if that's still a fact. I don't believe it is, but teenage pregnancy in general has gone down. But you are thinking of this child who is now going to be a mother and take care of a child. And one of my experiences when I was in nursing school was we had to do a visiting nurse aspect, and we went into some of these homes. And to be honest, it was shocking, what they had for food in their refrigerators, or how they lived in general in without a lot of resources. And I see that now in my patients, not that I go to their homes, but I think we can get so removed when we live in a certain set of a society that how other people live and what their challenges and issues are. So I really wanted to, like I mentioned earlier, plant seeds of okay, you are a mother and you can be a mother and other things. it is a little bit somewhat heartbreaking sometimes when you have a 21-year-old who is, potentially on her third child. And, I was just talking to a patient the other day and she said, "Oh, I feel like I'm infertile. I'm 21 years old and I haven't used any birth control." And she's like, "I'm so behind in my country. I'm so behind." And I believe she was from Brazil, but she's like, and I'm like, there's so many other aspects that I want to impart to her, but it's not part of their culture. So I have to actually be really mindful of the cultural piece with women. As far as older mothers, we do actually have now where I work at the center, we have, I want to say, a good percentage of what we call advanced maternal age, anyone over the age of 35, which I don't know, kind of rubs me a little bit the wrong way, but the risks slightly increase in a pregnancy over the age of 35. So we attend to them a little bit more. They have a little bit more, visits, extra testing, extra ultrasounds, things of that nature to, instill a healthy pregnancy. When I reflect back to when I was a labor and delivery nurse, one scenario just specifically popped into my head. People used to say to me that, "Oh my gosh, it must be so fun to be a labor and delivery nurse." And I always say, it generally is, but the times that it's not, it's really, really sad. And one of the situations that I remember distinctly was this woman who had, she had 4 full-term pregnancies and no back history of any kind of medical complications at all. But she went in for her visit and there was no fetal heartbeat. And it is a sad scenario that does happen. And it's, even happened in my position now. This particular woman was very religious and, very removed and accepting, but in that situation, and as a support person, as a nurse in the room, that woman has to deliver this baby that is no longer living. And it is something that you almost have to, you're going through the motions of doing this, and it's very, very, very hard. You can't even imagine what this woman is going through and all her hopes and dreams and the children she had. And, we did everything that we were trained to do at that time. You are supporting the person as she's, going through and delivering this child. And to her, it is her baby. And, we would, do pictures and give them a piece of clothing and their, the name tags. And, you really try to make it an, what's the word I'm looking for?
Memories to hold on to?
Yes, something to hold on to, because obviously she is going to walk through and never, ever lose that part of her. But there's always the scenarios that you want to do over and, what did you do wrong and questioning and all these things. And, the only thing you can do is hold space for that person. And there's no words. There's nothing. I mean, honestly, I get shivers thinking about it because I did a lot of these deliveries of just putting my hands on her hand or just letting her know that you're there, not saying anything. It's a very challenging part of being a labor and delivery nurse.
Is it hard not to bring it home?
I was just thinking when I was first a labor and delivery nurse, I did not have children, or I had my first child, my son, when I was still a labor and delivery nurse. And yeah, I mean, it's heartbreaking. I know some of, the labor and delivery nurses had been pediatric nurses and they could not mentally and emotionally do that anymore because it was so heartbreaking, some of the stories. So labor and delivery had more happy scenarios that didn't influence their everyday lives. I think that you almost have to like part of protective bubble or kind of a numbing thing, almost how we're experiencing now in society with all the shootings. It's become so common that we're almost numb to it. And I think that that's what sometimes happens to people after they experience so many tragic things.
What drove you to become a nurse practitioner and get your advanced degree?
I had always wanted to be a nurse practitioner, but then I had children, and it wasn't like the right time to go back to school because of my former husband's career. So I chose for a short bit of time, actually a decade, to stay home with my children. I got to a point after my first marriage dissolved that I sat there and I thought, what do I really want to do with my life? This is my opportunity to recreate myself. And I was stepping into this new dimension of my children being older and the role and I hadn't worked as a nurse in a little bit of time. And so the role from a nurse to a nurse practitioner is a completely different role. A nurse, they're given a set of orders, and this is what you do with a patient. And there's definitely decision making in being a nurse. But as a nurse practitioner, you are diagnosing the patient.
More doctor-like.
Yes. Oh, absolutely. We're at my current position, we're all considered quote unquote providers, the physicians and the NPs, and the nurse practitioners NPs at my job do almost the same things unless it's something that's surgical intervention would be needed.
So where are you now and what are you doing now?
Oh my gosh, I love my job so much. In the sense of that, I always say I love my patients so much. So I work in Lowell with a very diverse population.
Explain that, because not everyone who listens is even from New England. Yeah. And Lowell is in Mass.
Yeah, Lowell, Massachusetts.
Suburb of Boston, more or less.
Yeah.
But what's it like?
It's a very diverse community. In fact, we have, I don't know how many languages, but on any given day that I see patients, I typically have over half of my patients that I see in a day do not speak English.
How many do you see in a day, roughly?
20 patients. Between 18 and 20 patients a day. Yeah, so we have interpreters.
But still, it's not that easy.
Oh, no.
Right?
I actually have to think about what words I want to say, because a lot of words don't translate in different languages. I don't know the percentages exactly, but we have a high percentage of people from Brazil. We have a lot of Portuguese, a lot of Cambodian, Khmer. We have Spanish, of course. Pashto. I didn't even know the language of Pashto until I started working there.
What do you learn about them with respect to sexuality and reproduction?
Oh, well,
because their cultures are different than ours. Their religions can be different than ours, too.
Yeah, definitely. I mean, well, I see a good percentage of patients that are in their pregnancy. I do a lot of prenatal visits, but I also do a lot of GYN care. I do a lot of contraceptive education. I do a lot of GYN or women's health issues. I do, your regular annuals. I actually love to do a patient's annual visit. This is my point, that I get to go through some of the health education, and I don't have a ton of time. But speaking of different cultures, a lot of our population is marginalized and lower socioeconomic status. We have patients that they have no transportation to even get to their appointments. Never mind, being able to make sure that they have enough food. They need services for homes. I do have patients that live in shelters and they're pregnant. I've had patients that have been, in domestic violence situations, and they have had to be removed, and they're pregnant, and they have no family. That's another thing too, that even though there's a huge sense of community in the Lowell area, there is so many patients that come here and that they have no family. This is why sometimes I'll use a specific example. She was pregnant with, I don't even remember, it was their 6th or 7th child, and they came in, and it was probably about their 20-week visit. The husband spoke English, but she did not, so we had the interpreter on for part of the visit, but she did not want to continue the pregnancy. And she was 20 weeks and she kept saying, I'm breastfeeding the other child. I'm breastfeeding my youngest right now. But they don't use birth control in that population as well. So she wanted us to have a medical reason of why she couldn't continue the pregnancy, and we had no medical reason. So we had to actually counsel her. Obviously Massachusetts has a pretty, what's the word I'm going to use, like extended or lenient abortion policies. But in this scenario, as much as none of us would ever judge any woman's choices, this to us felt very unsettling. It felt very unsettling.
How did COVID change your role?
There was a barrier there. There was a barrier there from the language, and then we also had all these restrictions from COVID, and there's another barrier. So I just felt the COVID was a barrier in actually providing care.
So with respect to people of childbearing age, we're the only developed nation without paid maternity leave. Our maternal mortality rate is higher than any other industrialized nation, and we're seeing more attempts to make abortion illegal across the country. What conclusions or concerns do you draw from that information?
I feel like we're living in a twilight zone. I cannot even believe all of these things that our mothers and grandmothers fought for, and we're coming up against them now. It just feels very surreal to me and unfair, and just, I don't know, a lack of power in our voices, or or what we can. I know we can do things. I know that we can do things on a daily basis, but there's other things that we're coming up against that are more systemic and truly deeper than the systems at play here. There's more conditioning, like family conditioning, that people can't see beyond their own tunnels. I have 2 daughters, and I just think, oh my gosh, I can't even imagine if they, I don't know, just came up against, I'll use for an example, if one of my daughters got pregnant right now and, they still have school and they want to do things, and what we would do, and the choice needs to be there. And not only just that, but what if their lives were, I mean, honestly,
it's hard to understand why there doesn't seem to be more of an emphasis on the woman and what she needs and what she wants.
I wish I had more answers. I honestly wish I had more answers, because I feel like I want to get on my soapbox and get so angry about it, and or me feeling like powerless on my own voice. Like, what can I do, or what can we do? Or, I think sometimes we're just can't believe this is happening at this time.
I feel like we've made a lot of progress in terms of women's rights in my lifetime. Mm-hmm. I'm 55, but I do see very glaringly in the last few years some big steps backwards, and it really concerns me. Mm-hmm. I just don't know how to make progress anymore when people aren't willing to recognize women's autonomy.
I don't know. We need a different approach. I don't know. I really don't know what the answer is. I wish I did.
What do you think is at the root in terms of our culture's need to control women's sexuality and reproductivity?
Oh, I love this question, and I have a lot to say about it. I mean, obviously we think it's power and control, but it's also fear of the power of women, fear of what we are capable, our voices, our power, what influence and change we can make. It's been shown that when female power and voices are in charge, things change. We make actually significant changes. And I think people are afraid. They want the same things. They don't want the change. They don't want as much as we say we want, we're satisfied with familiarity or it's all we know and the comfort zone. Like, as much as we say we want things to change, we don't always, or we think we do, but it's an unknown. It's an unknown that people are afraid of. I don't want to pit men against women at all. And I don't think my feminism or anyone's real true feminism is about that. I think it's about a systems approach, because I think individual men and individual women sitting down and having conversations about the power dynamics, but they do play out in larger systems. They play out in communities. They play out in our homes, and the power dynamic, releasing some of that power takes power. It takes a strong and really self-assured and self-aware man to be able to do that. And it takes a very strong, self-assured in her voice, in her power, in her bigness, I guess I'll call it, to actually feel that power or want to take that power. And honestly, I don't even think and maybe this is just my experience as a woman, I don't think that I could have stepped into that power in my 20s or 30s. It would have been my 40s or 50s.
What problems do you see in our healthcare system, and how can we create better outcomes?
Oh my God. I think if you listen to anyone or talk to anything, you're like, healthcare is broken. It's so broken. It's not even backwards. We focus on the wrong things instead of looking at the bigger picture of real, true healthcare and prevention. Those things are not highlighted or emphasized at all. I mean, maybe they are slightly, but you go into your provider's office with a specific concern, and we're like, okay, this is what we need to do. This is what we need to order for you. This is what we need to potentially, put a Band-Aid on it. Sometimes we do that. I try not to be, that type of provider that puts a Band-Aid on it. But we do need more information before we are able to, make a plan for a patient. But a lot of times, I think when our chronic health conditions are so prevalent right now, our metabolic health, we are in a metabolic crisis in our health, in the sense of like our diabetes rates, our our obesity rates and diabetes, and our overall. We need to like pick back some of those layers of attending to those root cause problems that we could never do in a regular visit with a patient.
Moving on to mental health, it seems like physical and mental health are still two separate silos in healthcare, and all the healing I've done in this past year tells me that they are interconnected, and that we as a medical community need to do a much better job understanding someone's mental health and how it impacts whatever physical ailment they're coming with.
Oh, yeah, this is like probably more of my passion in my wheelhouse than anything else about women's health. I guess I would call the medicine that I type of practice is, trauma informed, is definitely out there, and it's out there, and everywhere you look, you hear the word trauma, trauma, trauma. But there is that whole thing about mind-body medicine and how what's happened to us embeds into our body and really reflects our state of health. And women, I'll look at it from a women's health perspective. Our emotional well-being is at the heart of all of it's at the heart of our health. And I think what's happened is that I remember reading an article years ago called, it's actually written by a psychiatrist, and it was in the New York Times, I believe. It's called, Medicating Women's Feelings. And that particular article changed the way I viewed everything, including antidepressants. And, there's a time and place for them. I totally believe that. But if we're meant to have, we're meant to have bad days. We're meant to have emotions. We're meant to feel sad. We're meant to grieve. And
We're meant to feel.
We're meant to feel. And like, I think people are afraid of feelings. Yeah. Our mental health is the foundation of everything. Like if we're not centered and grounded in ourselves and our sense of self and our self-awareness, in our, ability to look inward, our ability to look inward with honesty and integrity and truthfulness. And like, sometimes, I think the person we gaslight the most is ourselves sometimes, and saying we're okay. I'm fine. How are you? Oh, I'm just fine. Even though we're struggling inside with one particular thing. And, I heard this quote years ago and I loved it. It's like, if one woman told the truth of her story, the whole world was split open. There's a lot to that. The surface level, not telling our deeper stories. Our stories, our vulnerabilities are our power.
There is still way too much stigma around mental health and seeking help for mental issues. And I've thought a lot about that in the past year because my daughters left home for college. And then COVID happened, so I really felt my world quieting in a lot of ways. That physically and mentally gave me more time to think about me and where I want to be in life and how healthy I am. And I realized my mind was still turbulent from a lot of pain that I had not resolved from being abused as a child. And so I finally started to work on that. And I have learned so much about myself, and in turn, I've become a lot more aware of other people's feelings, and I can almost see suffering more clearly than I have ever been able to see. And it's given me more compassion for myself. It's given me more compassion for the rest of the world. It's helped me become connected to who I really am and not hide who I am. And it's helped me to be more deeply connected to those around me. So I just can't say enough about seeking help when you think something's not right, whether it's a broken bone or a broken brain. And I wish we could look at it that easily with the same lack of judgment as we do when someone breaks a bone.
What you're saying to me completely resonates. I was just on a walk by myself on Sunday morning, and I was thinking about my 20s, 30s, probably early 40s, where my life was very, very full and busy. But I felt extremely disconnected from myself because I was just running from one thing to the next thing without actually stopping to process some of my feelings. Although I've always been a curious person and very interested in my internal world, it just kind of went by the wayside a little bit until in my late 40s and early 50s, I felt like my world has gotten somewhat smaller and quieter, and there was no escape. Escapism is actually a thing. It's a real thing.
Well, it's like working too much.
Yeah. It's
raising kids.
Yeah.
We're busy.
Oh, we can always distract ourselves from a million.
There's a million things on TV.
Oh, yeah. And all of those things. I was an extreme exerciser for most of my, up until probably about 45 years old. And things shifted in the way that I looked at all the ways I escaped to, I don't know, self-medicating some of the things that I didn't want to look at. My family situation, as you mentioned, childhood things, trauma, things are, popping up. It's like a ball. You can't keep pushing them down because that ball keeps wanting to bounce right back up. And there are, I think we all have stories, and everyone talks about the small T traumas and the big T traumas. I'm a huge fan of Gabor Maté, who's like,
I love him.
Oh my gosh. He's like, oh my God, I want to be like a female Gabor Maté, actually. But he's like, yeah, he is beyond impressive and brilliant.
So he wrote the book, The Myth of Normal. He's a doctor from Canada. And then he also was a big part of that documentary called, what was that? Documentary.
I think it's The Wisdom of Trauma.
Wisdom of Trauma, and I watched that as well.
Yeah.
But yes, it just completely blew away and changed my understanding of trauma and how it's connected to your body and to your physical health.
Yeah, I mean, we can't ignore it.
We do.
No, so as much as it's like, I don't know, you see it in every, you can swipe through Instagram for 10 minutes and see the word trauma, trauma, trauma. It's all there. But it's because we haven't been paying attention to all of it. I mean, granted, we don't have the traumas of some of the things that, our parents probably grew up with, a completely different type. We can't, it's like comparing apples to oranges. The trauma that we're experiencing now, I mean, even just like we were talking about COVID, I mean, we're having some post residual COVID trauma right now. Everybody needs to read his work because, I mean, we'd have a healthier society,
And, people can find that in religion. They can find it in spirituality. They can find it in therapy. I don't think it matters so much what your path is, but it matters that you're curious. It matters that maybe you can say to yourself, is there a better way? And let's try to explore how we can find that way.
Yeah, I mean, in the last year, I have settled down and made my life really quiet as I actually took a year of solitude to completely grieve some of my old life traumas. And I've read a million books, and then I thought about all the exposure we have to social media. It's like we have all these social media, I'll use Instagram therapy as like now a thing. And, those are just small snippets of information, but those small snippets of information can propel a person into looking at some of those aspects and start questioning and asking, talking to their friends, talking to their therapists, like whatever, of certain things that they never even really thought about, but they have always been there. And some of my friendships have actually shifted, like boundaries. I mean, I know boundaries is a big word right now too, but allowing that whole thing of allowing people to treat us a certain way and what is okay with us.
All the things that I've read, I still believe that it was being with a therapist that really made it all gel and made it all make sense, because piecemeal, it was good, but it was great when I had a professional really explore me and how to fix the things that I didn't like. But yeah, I think what's also scary too is that people know they might lose a spouse or a friend who has some of the habits that they no longer want to participate in. You may have to lose some things to be the person you want to be. And so it's maybe easier to sit with what's known than to have the courage to explore how great things can be.
When I was in my early 40s, I remember saying to a friend, I don't think that I can become who I am meant to be by staying in my marriage. And that was a huge aha. And the person that I became was uncharacteristic of who I am as a person, because I am completely honest and direct, and I maneuvered my way around not really just saying to my ex-husband, I don't want to be married to you anymore. I eventually, said it, but said it in a way that was more, my actions said it more than I could actually even say the words, because I was afraid of losing my family and what I had built, and, a home and my children, and how are we going to do holidays and splitting them and all of those type of things. But I had to be true to my own sense of self. And, I've spoken to that before. I've written things about that. where you have to make there's going to be losses in all of your choices. And I think sometimes maybe women, we're afraid of that. Goes back to like the sense of power. We are afraid of what choices we might make.
There are losses though too, when we continue to live in our misery.
Oh, absolutely. I completely agree. There's a choice to keep staying in the same situation or the fear of the unknown. I mean, we all hear about that. I mean, every wise prophet in the world has always talked about that. Like, being on the edge. I feel like I'm on the edge right now. I'm in this, the space between stories, and it's actually a really uncomfortable place, and people are afraid of that discomfort.
Karin, what major life events have shaped you, not so much professionally, but personally?
The first major life event that shifted everything, and I didn't even bring this up earlier, was when my mom was diagnosed with cancer when I was actually in nursing school. It actually stimulated, I don't know if that's the word, me to take better care of myself. I mean, she was diagnosed of colon cancer, which is a preventative disease. And often at that time, they believed it was related to diet. But it obviously can be prevented by regular screening. It can't be prevented. It can be early detection can actually lead to better outcomes. When my mom was diagnosed with cancer when I was in my early 20s, she started on a process of like what most cancer patients do. She started juicing, and she went to she did all the mainstream medical things, but she went to an herbalist. She got acupuncture and Reiki. And here I was 20 years old. This was 30 years ago. I know all of these things are, all the rage, including all the, technology of, many different things now. But it inspired me to live a healthier life. I mean, I used to say to people, I was shopping at Bread and Circus, which it used to be called Whole Foods, when I was like 20 years old, and buying all organic food before it was like in vogue, or going to farmers markets because, who always wants to support the big markets, but it really influenced how I look at health overall and being accountable to our health. I mean, we don't have control over everything, but our choices do influence our health.
You wrote that she started doing a number of things differently after her diagnosis. What did you see happening, and how did that affect you?
Granted, it was like an age when I was, I don't know what the word was, a little less enlightened, I'll say. But she started riding a motorcycle, which was, slightly embarrassing for me. I'm like, oh my God, my mother's on like Harley-esque type of bicycle. But she was in a riding group for women, and she started ballroom dancing, and, she was just threw herself in anything and everything, including, as I've spoken to, she, I don't even remember how it came about, but she said to me at one point that, you love who you love. And, she had, at the end of her life, many female partners. So
I'm really sorry that your mother left you way too soon. And I know that your brother did too. So two brothers.
Both of my brothers passed away.
You've had a lot of loss. How did that change you?
I know. I feel like, thankfully, I'm in a good space, because sometimes I actually cry when I think about that. When people say to me, oh my gosh, I can't believe how much loss you've had. My first brother passed away. He went to grad school, and he was an accountant. He had a big job in a Connecticut, accounting firm. And he actually had some mental health issues as well. And I don't know if he actually had ADHD or bipolar, but, he had a little bit of a combination of those two, and he was on medication and mixed them with, heroin. And so both of those were found in his system. I mean, he had gone to work. I always say he had gone to work on a Friday and overdosed on a Saturday. And then my younger brother, he actually, was a little bit more of a lost soul. He never went to college, and not that that's, the end all and be all of anything, but, he had a great, like, I don't want to say blue collar job. I guess the trades. He was in the trades, and he basically drank himself to death. Substances, alcohol, mental health, trauma, grief has been a dominant theme in my life, and despite all of it, I've remained pretty relatively happy and centered, and very attuned to how short life can be.
How did you get to be the way you are today?
Oh my God. I think it's a combination of so many different experiences, between, focusing on like my physical health. Self-care is a supreme priority to me. I exercise every day. I do try to meditate. I sometimes at this point in my life only have time to do like a guided meditation. At times yoga is, I practice yoga at least probably 5 times a week. I am out in nature. I journal sometimes. I read a lot. I spend a lot of time right now alone, and it's informed my life a lot and gotten me more in tune with who I am, my sense of self, what I'm allowing into my life. I'm in this like in-between stage, transitional state between stories. And I think I have a little bit of a sense, not a little bit, not a little bit, a lot of sense of faith, a spirituality, a knowing, a greater universal understanding that something is at work here.
Who inspires you? Who do you read? What do you listen to?
Okay, well, right now, I am down this major rabbit hole, and I really wanted to write about it some more because it is a huge piece of women's health that we are not talking about enough at all. I started to learn a little bit more about, I guess it's related to my trauma, but there was some other things that have happened in my life recently that inspired me to look within at the substances or what we take into our lives and what we consume, from not even just our food. But then I started to look at, I've never had an issue with alcohol, but the more I started to read about or learn about, how it's really a poison and what it does to our bodies, and how it's very marketed to women, and it's responsible for, I don't even know, they say 7 different types of cancers, including breast cancer, of throat, obviously anything in the GI tract. And I just have been starting to question, is there a place for this in my life? I just haven't liked how I felt as I've gone through menopause. I'm not even in menopause. I haven't completed my menopausal year, but I don't like the way my body feels with certain substances in my body. And the more I talk to other women, they're not feeling really great about the decision to drink daily either or anything. I have been just seeing it more and more about people questioning what it's doing to us as a society. And, here I was, I'm like, well, I've never been a big drinker and I don't drink. And, nobody would ever question if I was an alcoholic, but I was like, here I feel like I have to have a rationale of why I don't want to drink. And,
because there's pressure everywhere.
Yeah.
It's so common.
Yeah.
It's like a social lubricant.
It is. And I was thinking about the times that in my life, how it connected me to certain people in my life. And, when that aspect goes away, then you have to look at what other things do I have in common with people or other ways we can connect. And I really want to be around women who ask themselves questions, who look deeply within themselves and have that growth mindset of like, I can change. And this new being of myself wants to make different choices.
Thank you so much, Karin.
Thank you for asking me to do this.
Dr. Maté's book and the documentary referenced in this episode are included in the show notes. Find Diary of a Nation through your favorite podcast app. Follow us on Facebook, Instagram, and Twitter at Diary of a Nation.